evening 6 p.m. IST. We'll discuss exciting topics, share your views, answer your questions, and we'll have a opinion about insights about different surgical aspects which will excel all of you to in your studies and in your exams. Please click the link given below. Hello my dear students, I am Dr. Sriram Bhatt, also known as Dr. SRB. You must have read my very popular best-selling books, SRB's Manual of Surgery, SRB Clinical Methods in Surgery, and SRB Surgical Operations. I am also practicing surgeon and professor in Kasturba Medical College and District Venlog Hospital, Bangalore, Dakshina Kannada, Karnataka. And I have got experience of last 38 years. I invite you all to come and interact with me live on my YouTube channel on 2nd June, Sunday evening 6 p.m. IST. We will discuss exciting topics, share your views, answer your questions, and we'll have a opinion about insights about different surgical aspects which will excel all of you to in your studies and in your exams. Please click the link given below. Hello my dear students, I am Dr. Sriram Bhatt, also known as Dr. SRB. You must have read my very popular best-selling books, SRB's Manual of Surgery, SRB Clinical Methods in Surgery, and SRB Surgical Operations. I am also practicing surgeon and professor in Kasturba Medical College and District Venlog Hospital, Bangalore, Dakshina Kannada, Karnataka. And I have got experience of last 38 years. I invite you all to come and interact with me live on my YouTube channel on 2nd June, Sunday evening 6 p.m. IST. We will discuss exciting topics, share your views, answer your questions, and we'll have a opinion about insights about different surgical aspects which will excel all of you to in your studies and in your exams. Please click the link given below. Hello my dear students, I am Dr. Sriram Bhatt, also known as Dr. SRB. You must have read my very popular best-selling books, SRB's Manual of Surgery, SRB Clinical Methods in Surgery, and SRB Surgical Operations. I am also practicing surgeon and professor in Kasturba Medical College and District Venlog Hospital, Bangalore, Dakshina Kannada, Karnataka. And I have got experience of last 38 years. I invite you all to come and interact with me live on my YouTube channel on 2nd June, Sunday evening 6 p.m. IST. We will discuss exciting topics, share your views, answer your questions, and we'll have a opinion about insights about different surgical aspects which will excel all of you to in your studies and in your exams. Please click the link given below. Hello my dear students, I am Dr. Sriram Bhatt, also known as Dr. SRB. You must have read my very popular best-selling books, SRB's Manual of Surgery, SRB Clinical Methods in Surgery, and SRB Surgical Operations. I am also practicing surgeon and professor in Kasturba Medical College and District Venlog Hospital, Bangalore, Dakshina Kannada, Karnataka. And I have got experience of last 38 years. I invite you all to come and interact with me live on my YouTube channel on 2nd June, Sunday evening 6 p.m. IST. We will discuss exciting topics, share your views, answer your questions, and we'll have a opinion about insights about different surgical aspects which will excel all of you to in your studies and in your exams. Please click the link given below. Hello my dear students, I am Dr. Sriram Bhatt, also known as Dr. SRB. You must have read my very popular best-selling books, SRB's Manual of Surgery, SRB Clinical Methods in Surgery and SRB Surgical Operations. I am also practicing surgeon and professor in Kasturba Medical College and District Penlock Hospital, Bangalore, Dashina Kannada, Karnataka. And I have got experience of last 38 years. I invite you all to come and interact with me live on my YouTube channel on 2nd June, Sunday evening 6 p.m. IST. We will discuss exciting topics, share your views, answer your questions, and we'll have a opinion about insights about different surgical aspects which will excel all of you to in your studies and in your exams. Please click the link given below. Hello my dear students, I am Dr. Sriram Bhatt, also known as Dr. SRB. You must have read my very popular best-selling books, SRB's Manual of Surgery, SRB Clinical Methods in Surgery and SRB Surgical Operations. I am also practicing surgeon and professor in Kasturba Medical College and District Penlock Hospital, Bangalore, Dashina Kannada, Karnataka. And I have got experience of last 38 years. I invite you all to come and interact with me live on my YouTube channel on 2nd June, Sunday evening 6 p.m. IST. We will discuss exciting topics, share your views, answer your questions, and we'll have a opinion about insights about different surgical aspects which will excel all of you to in your studies and in your exams. Please click the link given below. Hello my dear students, I am Dr. Sriram Bhatt, also known as Dr. SRB. You must have read my very popular best-selling books, SRB's Manual of Surgery, SRB Clinical Methods in Surgery and SRB Surgical Operations. I am also practicing surgeon and professor in Kasturba Medical College and District Penlock Hospital, Bangalore, Dashina Kannada, Karnataka. And I have got experience of last 38 years. I invite you all to come and interact with me live on my YouTube channel on 2nd June, Sunday evening 6 p.m. IST. We will discuss exciting topics, share your views, answer your questions, and we'll have a opinion about insights about different surgical aspects which will excel all of you to in your studies and in your exams. Please click the link given below. Hello my dear students, I am Dr. Sriram Bhatt, also known as Dr. SRB. You must have read my very popular best-selling books, SRB's Manual of Surgery, SRB Clinical Methods in Surgery and SRB Surgical Operations. I am also practicing surgeon and professor in Kasturba Medical College and District Penlock Hospital, Bangalore, Dashina Kannada, Karnataka. And I have got experience of last 38 years. I invite you all to come and interact with me live on my YouTube channel on 2nd June, Sunday evening 6 p.m. IST. We will discuss exciting topics, share your views, answer your questions, and we'll have a opinion about insights about different surgical aspects which will excel all of you to in your studies and in your exams. Please click the link given below. Hello my dear students, I am Dr. Sriram Bhatt, also known as Dr. SRB. You must have read my very popular best-selling books, SRB's Manual of Surgery, SRB Clinical Methods in Surgery and SRB Surgical Operations. I am also practicing surgeon and professor in Kasturba Medical College and District Penlock Hospital, Bangalore, Dashina Kannada, Karnataka. And I have got experience of last 38 years. I invite you all to come and interact with me live on my YouTube channel on 2nd June, Sunday evening 6 p.m. IST. We will discuss exciting topics, share your views, answer your questions, and will have a opinion about insights about different surgical aspects which will excel all of you to in your studies and in your exams. Please click the link given below. Hello my dear students, I am Dr. Sriram Bhatt, also known as Dr. SRB. You must have read my very popular best-selling books, SRB's Manual of Surgery, SRB Clinical Methods in Surgery and SRB Surgical Operations. I am also practicing surgeon and professor in Kasturba Medical College and District Venlock Hospital, Bangalore, Dakshina Kannada, Karnataka. And I have got experience of last 38 years. I invite you all to come and interact with me live on my YouTube channel on 2nd June, Sunday evening 6 p.m. IST. We will discuss exciting topics, share your views, answer your questions, and will have a opinion about insights about different surgical aspects which will excel all of you to in your studies and in your exams. Please click the link given below. Hello my dear students, I am Dr. Sriram Bhatt, also known as Dr. SRB. You must have read my very popular best-selling books, SRB's Manual of Surgery, SRB Clinical Methods in Surgery and SRB Surgical Operations. I am also practicing surgeon and professor in Kasturba Medical College and District Venlock Hospital, Bangalore, Dakshina Kannada, Karnataka. And I have got experience of last 38 years. I invite you all to come and interact with me live on my YouTube channel on 2nd June, Sunday evening 6 p.m. IST. We will discuss exciting topics, share your views, answer your questions, and will have a opinion about insights about different surgical aspects which will excel all of you to in your studies and in your exams. Please click the link given below. Hello my dear students, I am Dr. Sriram Bhatt, also known as Dr. SRB. You must have read my very popular best-selling books, SRB's Manual of Surgery, SRB Clinical Methods in Surgery and SRB Surgical Operations. I am also practicing surgeon and professor in Kasturba Medical College and District Venlock Hospital, Bangalore, Dakshina Kannada, Karnataka. And I have got experience of last 38 years. I invite you all to come and interact with me live on my YouTube channel on 2nd June, Sunday evening 6 p.m. IST. We will discuss exciting topics, share your views, answer your questions, and will have a opinion about insights about different surgical aspects which will excel all of you to in your studies and in your exams. Please click the link given below. Hello my dear students, I am Dr. Sriram Bhatt, also known as Dr. SRB. You must have read my very popular best-selling books, SRB's Manual of Surgery, SRB Clinical Methods in Surgery and SRB Surgical Operations. I am also practicing surgeon and professor in Kasturba Medical College and District Venlock Hospital, Bangalore, Dakshina Kannada, Karnataka. And I have got experience of last 38 years. I invite you all to come and interact with me live on my YouTube channel on 2nd June, Sunday evening 6 p.m. IST. We will discuss exciting topics, share your views, answer your questions, and will have a opinion about insights about different surgical aspects which will excel all of you to in your studies and in your exams. Please click the link given below. Hello my dear students, I am Dr. Sriram Bhatt, also known as Dr. SRB. You must have read my very popular best-selling books, SRB's Manual of Surgery, SRB Clinical Methods in Surgery and SRB Surgical Operations. I am also practicing surgeon and professor in Kasturba Medical College and District Venlog Hospital, Bangalore, Dakshina Kannada, Karnataka. And I have got experience of last 38 years. I invite you all to come and interact with me live on my YouTube channel on 2nd June, Sunday evening 6 p.m. IST. We will discuss exciting topics, share your views, answer your questions, and we'll have a opinion about insights about different surgical aspects which will excel all of you to in your studies and in your exams. Please click the link given below. Hello my dear students, I am Dr. Sriram Bhatt, also known as Dr. SRB. You must have read my very popular best-selling books, SRB's Manual of Surgery, SRB Clinical Methods in Surgery and SRB Surgical Operations. I am also practicing surgeon and professor in Kasturba Medical College and District Venlog Hospital, Bangalore, Dakshina Kannada, Karnataka. And I have got experience of last 38 years. I invite you all to come and interact with me live on my YouTube channel on 2nd June, Sunday evening 6 p.m. IST. We will discuss exciting topics, share your views, answer your questions, and we will have a opinion about insights about different surgical aspects which will excel all of you to in your studies and in your exams. Please click the link given below. Hello my dear students, I am Dr. Sriram Bhatt, also known as Dr. SRB. You must have read my very popular best-selling books, SRB's Manual of Surgery, SRB Clinical Methods in Surgery and SRB Surgical Operations. I am also practicing surgeon and professor in Kasturba Medical College and District Venlog Hospital, Bangalore, Dakshina Kannada, Karnataka. And I have got experience of last 38 years. I invite you all to come and interact with me live on my YouTube channel on 2nd June, Sunday evening 6 p.m. IST. We will discuss exciting topics, share your views, answer your questions, and we will have a opinion about insights about different surgical aspects which will excel all of you to in your studies and in your exams. Please click the link given below. Hello my dear students, I am Dr. Sriram Bhatt, also known as Dr. SRB. You must have read my very popular best-selling books, SRB's Manual of Surgery, SRB Clinical Methods in Surgery and SRB Surgical Operations. I am also practicing surgeon and professor in Kasturba Medical College and District Venlog Hospital, Bangalore, Dakshina Kannada, Karnataka. And I have got experience of last 38 years. I invite you all to come and interact with me live on my YouTube channel on 2nd June, Sunday evening 6 p.m. IST. We will discuss exciting topics, share your views, answer your questions, and we will have a opinion about insights about different surgical aspects which will excel all of you to in your studies and in your exams. Please click the link given below. Hello my dear students, I am Dr. Sriram Bhatt, also known as Dr. SRB. You must have read my very popular best-selling books, SRB's Manual of Surgery, SRB Clinical Methods in Surgery and SRB Surgical Operations. I am also practicing surgeon and professor in Kasturba Medical College and District Venlog Hospital, Bangalore, Dakshina Kannada, Karnataka. And I have got experience of last 38 years. I invite you all to come and interact with me live on my YouTube channel on 2nd June, Sunday evening 6 p.m. IST. We will discuss exciting topics, share your views, answer your questions, and we will have a opinion about insights about different surgical aspects which will excel all of you to in your studies and in your exams. Please click the link given below. Hello my dear students, I am Dr. Sriram Bhatt, also known as Dr. SRB. You must have read my very popular best-selling books, SRB's Manual of Surgery, SRB's Clinical Methods in Surgery and SRB Surgical Operations. I am also practicing surgeon and professor in Kasturba Medical College and District Penlab Hospital, Bangalore, Dakshina Kannada, Karnataka. And I have got experience of last 38 years. I invite you all to come and interact with me live on my YouTube channel on 2nd June, Sunday evening 6 p.m. IST. We will discuss exciting topics, share your views, answer your questions, and we'll have a opinion about insights about different surgical aspects which will excel all of you to in your studies and in your exams. Please click the link given below. Hello my dear students, I am Dr. Sriram Bhatt, also known as Dr. SRB. You must have read my very popular best-selling books, SRB's Manual of Surgery, SRB's Clinical Methods in Surgery and SRB Surgical Operations. I am also practicing surgeon and professor in Kasturba Medical College and District Penlab Hospital, Bangalore, Dakshina Kannada, Karnataka. And I have got experience of last 38 years. I invite you all to come and interact with me live on my YouTube channel on 2nd June, Sunday evening 6 p.m. IST. We will discuss exciting topics, share your views, answer your questions, and we'll have a opinion about insights about different surgical aspects which will excel all of you to in your studies and in your exams. Please click the link given below. Hello my dear students, I am Dr. Sriram Bhatt, also known as Dr. SRB. You must have read my very popular best-selling books, SRB's Manual of Surgery, SRB's Clinical Methods in Surgery and SRB Surgical Operations. I am also practicing surgeon and professor in Kasturba Medical College and District Penlab Hospital, Bangalore, Dakshina Kannada, Karnataka. And I have got experience of last 38 years. I invite you all to come and interact with me live on my YouTube channel on 2nd June, Sunday evening 6 p.m. IST. We will discuss exciting topics, share your views, answer your questions, and we'll have a opinion about insights about different surgical aspects which will excel all of you to in your studies and in your exams. Please click the link given below. Hello my dear students, I am Dr. Sriram Bhatt, also known as Dr. SRB. You must have read my very popular best-selling books, SRB's Manual of Surgery, SRB's Clinical Methods in Surgery and SRB Surgical Operations. I am also practicing surgeon and professor in Kasturba Medical College and District Penlab Hospital, Bangalore, Dakshina Kannada, Karnataka. And I have got experience of last 38 years. I invite you all to come and interact with me live on my YouTube channel on 2nd June, Sunday evening 6 p.m. IST. We will discuss exciting topics, share your views, answer your questions, and we'll have a opinion about insights about different surgical aspects which will excel all of you to in your studies and in your exams. Please click the link given below. Hello my dear students, I am Dr. Sriram Bhatt, also known as
Good evening students and esteemed colleagues. It's my pleasure to host this event. Good evening everyone. This is Dr. Bhargav Vyas, working as a consultant in Medical Hospitals, Kurnool, Andhra Pradesh. Mhm. Dr. Sriram Bhatt, popularly he is known as Dr. SRB, hailing from Mangaluru, Karnataka, has been in the field of teaching for over 34 years now. He is ex-HOD of Kasturba Medical College, Mangalore. Currently, he is working as a professor and consultant in several other private hospitals. Dr. SRB is an author of one of the famous selling books like SRB's Manual of Surgery, SRB Surgical Operations, Clinical Methods in Surgery, Atlas for Tissue Approximation with Suturing and Knotting, Surgery for Dental Students, and etc. Surgery Insights is a platform which is owned by Dr. SRB himself, and it will be a platform to discuss exciting topics, answer complex questions, share some valuable insights on surgery to help the students, both undergraduates and postgraduates. So why Surgery Insights? So in Surgery Insights, we will be organizing live sessions. We'll be having short lectures, question and answer sessions. There will be practical lectures, and there will be tips for competitive exams and how to answer questions for both undergraduates and PGs. It is my distinct pleasure to introduce few extraordinary medical professionals who are students of Dr. Sriram Bhatt. First, we have here with us Dr. Rajat Chowdhury. He's a compassionate young doctor pursuing his specialization in surgical oncology from SMS Jaipur. Dr. Rajat.
Hello, good evening, sir. Good evening, everyone. Hello, hi, students. Yeah, so I'll be talking about how we have worked about with SRB, sir. I consider myself really lucky to have been given this chance and opportunity to learn and train under SRB, sir. I had read sir's book, SRB's Manual of Surgery, during my undergraduate days for my MBBS, and since that time, sir was had really inspired us from his book. And when I got the chance to prepare and do my residency at Kasturba Medical College in Mangalore, the sole reason I opted to choose the college was for the opportunity of working and learning from sir. I was really lucky, and I would say that I fall short of words to mention and explain what a great teacher sir has been, and a clinician par excellence and a meticulous surgeon that he has been, that we learned and trained under him. I can't think of any procedure or any topic in surgery that sir hasn't mastered and will not be able to teach you about. Training under sir and learning from him has been an experience that I hope that every single student in surgery, every surgical resident gets to experience at some point of time in their lives. The training under him has, I would say that sir has literally held our hands and taught us how to operate from the basics of surgery to even the complicated steps. I still remember the first Whipple surgery I was assisting sir with. That was the first time I was seeing that case, Whipple's procedure. And I told sir that, sir, this is the first time I'm seeing it. So sir took time during the surgery to explain each and every step of the procedure again and again to me, and made sure I understand. And just even though I was observing the surgery for the first time and a single time, I was able to grasp one of the most complicated procedures in surgery with ease. That is sir's excellence. Every rounds that sir has taken with us is a masterclass in surgery by itself. He would have some point or the other to teach you with every single patient, be it a small case with just an ulcer or some complicated abdominal GI case. Sir has always considered teaching as his most foremost passion, and he has strived to teach the students in every which way possible. With this new endeavor of sir, that is the Surgery Insights, I hope that so many students can take advantage of him and able to learn from him. He would be guiding so many of us like he has done in the past, and even the students who are not in reach with him directly will be able to benefit from sir. And I hope this program is a huge success. All the best to sir, and good luck to all the students who will learn from him in the future. Thank you.
Thank you, Rajat. Thank you. Next, we have Dr. Tala Ahmad. a doctor with unwavering commitment to patients. He is working in the Department of Vascular Surgery in United Kingdom right now. Dr. Tala,
Hello, everyone. Can you hear me properly?
yes, Tala, yes, we can hear you.
Hi. So, I think Dr. Bhargav and Rajat have, uh, briefly explained about their experience with working with Dr. SRB. Personally, as a student under his guidance, I can attest to his exceptional abilities as an academician and a mentor. Now, I'm going to be referring Sriram Bhatt sir as SRB continuously because that's how lovingly we as students used to call him. So, Dr. SRB has received numerous accolades, including multiple Best Teacher Awards, which speak volumes about his dedication and excellence in teaching. Now, his works like SRB's Manual of Surgery, his clinical methods, his operative surgery have simplified complex, surgical techniques for me, and those are treasured by students and practitioners worldwide. And I can personally tell you that I have read these books, and that has played an important, significant impact in my career, both currently working in the UK as well as my student life. Now, I personally did not was not posted in Dr. SRB sir's unit, but I still regret it to this day. But Dr. SRB has always been approachable. He was always willing to clear my doubts, no matter how trivial they are or how stupid they might seem. Now, his passion for teaching is evident not only in his awards that he has received for the best teacher and for the best outgoing, faculty in surgery, but those are also evident from his numerous publications in his books and his research articles as well. Now, when I was working in the Department of General Surgery in Kasura Medical College, he was the head of the department. And I can tell you that he was a constant support and guidance for me during my postgraduate years. Now, this new venture, Surgery Insights, which are available on platforms like YouTube and Instagram, I still regret that this wasn't there when I was doing my post graduation because I could definitely benefit from it rather than personally messaging or meeting SRB sir and asking him about the doubts. But this venture is definitely a valuable resource, and it's a boom for all the students and surgical peers worldwide, and a great sort of opportunity for directly interacting with this knowledgeable gentleman. Now, together as we gather for the first ever live YouTube session, I'm filled with pride and gratitude. Now, sir, even as I stand here in the UK, I will always remain your student, and I always will come up to you for all my stupid doubts and questions. Now, if you find me anonymous with some questions probably coming from me, and if you see it's from the UK, it's definitely coming from me. If you can, be prepared for that. And I would also tell everyone that flood your questions with Dr. SRB and clear all your doubts. Now, to all the students tuning in, I urge you to make use of this incredible opportunity. No question is trivial or nonsensical. Every inquiry is a chance to deepen your understanding and learning. Embrace this chance to engage with this wonderful and knowledgeable gentleman and benefit from his vast knowledge and experience. I assure you, this platform will be more rewarding than any other paid resource that most of our students are doing at the moment. Now, with that, I am again delighted to welcome Dr. SRB sir. I wish everyone a fruitful and enriching learning experience, and just bombard sir with all your questions that you have. Thank you very much.
Thank you, Tala. Thank you very much. Students, sorry for the inconvenience. Because of my location, there is some bandwidth problem and I can't run on my video. So next we have Dr. Divya. He's an Ayurvedic doctor, but who has worked with Dr. SRB sir for almost 5 years. He will share his insights about Dr. SRB sir. Dr. Divya.
Yeah, good evening, sir. Good evening, SRB, sir. So, before I start, I would say every great achiever is inspired by a great mentor, and I am so lucky to have got a great mentor like SRB, sir. Being Ayurveda, I have finished my MS. Throughout the 5-6 years I was trained under sir. So, moreover, I have got what we say, how usually sir used to say, like one should have a lion's heart, one should have a eagle's eye. So, all sir have got developed in me by working with sir. So what I would like to say about sir is like how to show empathy towards patients. So that what I have learned from sir, and what patient is going under, that care what sir is giving to the patient throughout his treating time. So that what we have learned, and now I'm working as an assistant professor in one Ayurveda college, and I am a proud consulting general surgeon and proctology. So where I have learned from all the sir through all 6 years. So sir has always guided us and always motivated. So he is a continuous source of inspiration for me, and I'm really inspired by seeing the hard working. So I will say like sir is like always work around 20 to 20 hours a day. I don't know where when sir sleeps, because whenever early morning 6 o'clock sir will call, come for the rounds, we'll be ready for the rounds. The evening whole time he will be in the college, he will be doing his work, he will be operating in there. Then evening again we will be having the OTs, and night again he will work for his books. So such a tireless effort sir is doing at this age also. So what now sir is coming with his new venture, that is surgical insights. Okay, so all students will be getting benefited from that. What we have got it from sir, now every student can get benefited by joining that channel. So go to the YouTube surgical insight and press the bell icon button and stay updated with the all the new videos whatever we are uploading. Thank you sir.
Thank you, Divya. Next, we have the pillar behind Dr. SRB sir, that is Dr. Meera ma'am. Good evening, ma'am.
Good evening, Bhargav.
Ma'am, kindly speak
Yes,
about Dr. SRB sir and the
yeah,
surgery insights, the idea behind it.
sure.
Thank you, ma'am.
Everybody, everybody knows him as SRB sir. He is always Sri Ram to me, who is both a teacher and a caring husband. I am privileged to witness his professional growth from a nervous surgeon in 1990s to the present day efficient surgeon. His determination and dedication towards whatever he does probably has definitely paid him. I'm privileged to witness his growth from a budding author of SRB's Manual of Surgery in 2001 to the present day author of SRB books. I'm also privileged to accompany him in his pathway as an author and a dedicated surgeon, which was not an easy. His patience, his perseverance, his passion towards his work, either it may be patient care, either book writing or teaching, is commendable. I had the privilege of editing all his books and editions. I used to be the first one to criticize his writings, but he used to respect all my suggestions and opinions. He's an enthusiastic and a fast learner, adaptive to all recent trends, and a great teacher. His knowledge and experience should not be restricted to books and be spread wisely and efficiently on an online platform like this. I really appreciate you and wish you all the best. Thank you.
Thank you, ma'am. Thank you very much. Yeah, I myself, Dr. Bhargav Vyas. So I finished my post graduation in 2018. Okay, in my post graduation, in the second unit, in my second posting, I was posted with Dr. SRB sir. I was posted in his unit. When I stepped into the unit, so I was in a state where like I can't even assist a major case. That was the scenario. Okay, but I stepped within 6 months. I have stepped out with a great amount of confidence. Okay, and from 2018 till 2023, SRB sir was my mentor. I used to go outside to assist SRB sir, and like I was in his same unit as a senior resident, then as assistant professor. So I know in and out how sir is. For me, whenever I did mistake or whenever there is something wrong on the operating room, Okay, he is the person who stood behind me and he taught me, holding my hands. Call it a small, minor surgery or a major thing, whatever it is, he used to explain everything in detail and let me do and gain the confidence. To Dr. Divya, Dr. Rajat, Dr. Thala, they have summed up almost all the parts. Okay, he's an excellent mentor and a very compassionate person towards the patient care. Working with him, it was very grateful, and I was very grateful that I worked alongside such a dedicated and compassionate surgical mentor. And his influence continues to shape my approach to the patient care and serve as a guiding light as I navigate my own journey in field of surgery. So I would like to introduce Dr. Sriram Bhatt. It is my distinct pleasure to introduce a cadre of extraordinary medical professionals whose expertise and commitment to excellence have set a standard of care admired throughout the field of medicine. Dr. SRB stands as a beacon of excellence, renowned not only for his books but also for his unwavering dedication to the advancing healthcare and surgical teaching. With a career of over 40 years, marked by his dedication and compassionate care, Dr. SRB has transformed the lives of countless patients and inspired generations of medical professionals. Please welcome the esteemed Dr. SRB sir as we celebrate his contributions to the art of science and surgery. Good evening, sir. Welcome, sir.
Good evening, Bhargav. Good evening, everybody, my students. And thank you, Bhargav, for a very nice introduction to me. I know you very well, and we had a very close association both together. We worked together nearly more than 6 years with
Yes,
a
sir.
close contact. You know that because we worked together in every aspect. Again, Rajat was very close to me. He was working with me. Tala was in my department. He was also very close and nice, and I had a lot of interactions with him during whenever possible, whenever time was there. Divya, of course, he was again always with me with morning to evening in my private work and private setup and all those working situations. And of course, my wife, Dr. Meera, is a gynecologist, but she's the backbone for me for all my adventures, writing books. That is professional and academic supported like anything actually. Without her support, it would not have been possible because nothing I know about my housework, all those things. Everything is done by her, whatever it is required, even editing, guiding, everything as a full-fledged affectionate support. So with this introduction, of course, there are so many other people, so many postgraduate students were there behind me, who has helped, who has interacted, who has been with me, who has learned, shown lots of affection towards me in these last 40 years near. I remember all of them, including my teachers, my colleagues, faculties from different parts of the country. There's so many faculties from different colleges. They have shown a lot of affection because of my book. Identified me without any bias and appreciated my work wholeheartedly without any question about Indian author, because those were 30 years back. Those days, Indian author books were a second grade books. This was the stage that time. Because if somebody reading Indian author book, they think that it was not right. So that slowly it is now evolution has changed. That Indian authors are good. They are much more dedicated. In fact, we are more dedicated. Surgeons in this country are more dedicated than anywhere else in this world. We work from day, morning to evening, night. Any patients comes, even poorest of poor comes. Most of the surgeons in this country, they immediately attend the patient without looking at the backup money, whatever in a government setup. They get operated immediately, no, without any fixing date. Come, any patient walks into the OP in a system in a Venlock hospital or government setup for hernia or anything, they don't give any date for them. Immediately admit, work for a day, and next day operate. It never happen. It will not happen in any European countries or elsewhere in the world. In this country, we work so much. We dedicated to our social system so much. I'm not telling only of me, everybody, most of the surgeons of this country are so much dedicated towards the society. So that part has given credit to us as an Indian authors. So truly it is coming up. I think we should be proud of ourselves, our system, our surgical professionals, our surgeons in this country. They do lot to our patients, to our social system, even though here and there comments are there, discredits are there, that you can not require to accept actually. This is the first thing. And next thing, of course, I started my career in 1986, joined as MS. Of course, Dr. Srivasan, Professor Jairam Shene was there. He's still there working in our college. So all these people have taught me so much in my building up the career, surgical skills, and so on. And eventually, of course, initially it is only open surgery, eventually laparoscopy come. Now it is robotic surgery, step by step, everything you are learning. And you know that surgery is everyday learning. It is learning daily until the last minute. Until you operate, you recognize it. Until you operate, you have to learn. Every day, every minute, it is the learning. Always, there's no the end to learn in this profession. You can learn from seniors, you can learn from your colleagues, you can learn from teacher, your students, you can learn from assistants, whoever it is. Many times assistants help us. I have seen so many times Bhargav has said, sir, we'll do like this. This will be better in a critical situation. So both good assistance is so much rewarding in surgical field, because both two brains working is better than single brain working when you do a major surgery, because it helps. Everybody thinks thinking assistant is so excellent and so important in surgical field, and not only in doing surgery, post-operative managing everything. It's hand. We need hands. We need a teamwork in surgery. That's what I credit to all these my junior students, whoever it is. Of course, my seniors are there to make me like this. And robotic will come. So things are changing. As a teacher, initially only lectures I used to take early morning, then demonstration, clinical exams, all those things. Now, of course, online systems have come. Things have changed. People want. Initially, I brought my book in 2002 to 3, first edition book. That book was small, actually, small book, 400, 500 pages. I think still I got. And with, of course, quotations started with the quotations of the old surgeons, good old 100 years, good old surgeons, like Kron's quotation I used to put. So this is my own thinking when I put my first edition. Eventually, edition has changed because of the demand from the students. They said they want furthermore. So I add on to, so I reached up to the 7th edition with so many, of course, the very good quality photos, illustrations, footnotes, tables, and so on. That is eventually because of the demand has changed. Now demand is, there's all these clinical books, manuals, operative surgery has come. I took 10 years to write the first edition of the operative surgery, because I got some 10,000 photos and illustration to edit everything. And of course, tissue approach book has come. So everything eventually it has come. So because of the demand which is required for the learning students as such. But again, demand is increased now because now everything is online platforms. So I thought at the age of 60, yesterday I finished my 60th birthday. I'm going to the 60 plus, probably senior citizen. So at this juncture, I thought I should make a platform in the YouTube platforms channel of my own. There's SRB Surgical Insight channel. So there's so many people have worked behind it. Of course, I'm very thankful to Dr. Bhargav, Dr. Divya, of course, my Dr. Gopal is there. People are around here. Those really helpful. Bhargav is a very knowledgeable person in this. Here, the sir will do like they will do. Keep on giving suggestions, and he got the people for this, all those things, and organized things from the platform. He's there in Hyderabad, his place, but from there only he organizes it. There's so many people have helped. This new adventure is required for the future students, current and eventual students. I thought so we put a platform wherein I can have a regular discussion, regular videos, small videos. I thought I'll put in every day 3 minutes, 2 to 3 minutes videos, so that you can learn every day something about surgery. Surgery is daily learning, not I will read surgery today and learn, because surgery you learn, keep on learning it, otherwise you'll forget surgery. Keep on doing, keep on learning is the basic concept for surgery. So I thought of YouTube, I'll have a channel so that we'll have a discussion. And I also have thought that we'll put some notes and these things whenever required. You may have to discuss a question paper. Eventually, in planning, may have discussed few MCQs because MCQs are becoming more and more in the exam pattern. So may have to tune towards the exam pattern of the students, and of course, weekly or once in fortnight, may do a live discussion interaction, probably case scenario. That also I thought of all this. So that's the reasons why thought of getting this new platform. And additionally, I thought why this is essential because I do, even though I'm 60, I do can work if everything permits another 15 years without any hassle. I'm still energetic. I'm 60. That's what I think. And additionally, what is the reason behind it is I can interact with the students everywhere, not only in my college. Other students everywhere from the country who are interested, they can join and they can see this one. So that interaction with everybody is possible. So I can be known to many other students. I can be known to this one, so that with this weekly or once in fortnight when I do a discussion for case, I can invite faculty whomever I know, good faculties. Knowledge, there are so many knowledgeable faculties are around the country, working silently, teaching silently, without any expectation. There's so many I know, so many friends are there. They're so good. They're better than me many times I feel, and definitely. And I'll invite them so they will have interaction with students, so that you will have the wider range of understanding and approach, and they can see widely. Always in surgery, you have to know you can't see focus. You see widely. Everything, think widely, see widely, do widely, observe widely. That is the concept behind surgery. So we can. This is the platform which will give for these things. So that is the idea. And many colleges, I'm not questioning it. Many colleges that in our college everything is good. There may not be enough patients. There may not be enough academic backup and teaching. I'm not blaming any college because surge of colleges are there, new colleges are there. So those students, if you are got any shortcomings about that, you can always join as far as surgery is considered, and uh, and and they can use this platform for their clinical discussion, for their understanding, for any questionnaire which as and time permits, I can explain whatever required. This is the idea of going for this channel. So daily small videos will be there. So I expect all students who are join this and subscribe and go ahead for that, so that regular event you can go through that. That is the important thing I want to tell. And these discussions are ongoing phenomenon. It's not a one day I will do and finish. I am definitely sure that I am mentally prepared for that. Regularly I will do these sessions and daily videos. I'll try to put always 2 to 3 minutes videos, so that small things in surgery, so that wider aspect you can go through the books, so that understand things, so that you'll have the picturized idea of small things, so that your thinking process. When there is surgery, is a disciplined thinking. It's an art. It's a perfect art, surgery. So your thinking process, analysis process, which is very essential for surgery, will be provocated by these small lectures. So we will keep on thinking. So you refresh your brain actually towards the surgical side. There's a reason why this platform again, probably in due course of time, daily basis, and of course try to have may include eventually for the NEET exam and all those things. So that's the idea of this surgical insight channel. Basically for surgery, no other field. Basically academic, of course, clinical plus theoretical, all those things, everything needed as to make a surgical system to understand very clearly. So that's the idea of why this channel I started from an author of many books toward the including continuing as author plus towards an online this one, which is very new for me. Of course, with the help of so many people who are backup for with this. I'm doing this newer, going for the newer thing, that is surgical SRB Surgical Insights YouTube channel. So that's about this surgical insight idea. So, Bhargav,
Yes. Yes, sir.
basic about this idea. So just to go through the small PPT is there or anything to interact in between?
Yes, sir. Like you go ahead with PPT and later like we'll go for the interactive sessions.
Okay, Shreya, will you put on the PPT? So this is about surgical insight. Next slide. Shreya, can you put next slide? So this is what my journey of writing surgically written book started from 2003 onwards. Mine backup for that, my students, that time later consecutively until current students, all PGs, UGs, throughout the last 22 years, everybody has supported me. Of course, my mentor, I can call, my supporter, who has wholeheartedly supported me for all work is Mr. Vich, Chairman, JP Publishers. He has everything, whatever I asked, whatever I told, he accepted without any this one. He trusted me so much. Definitely, this is the man behind who made all these books as in the current status as such. Of course, readers, students, both UGs, PGs across the country, abroad, throughout the last more than 20 years, faculties, so many faculties have seen my book, helped me, and told this book is good and rather promote it. Like Mohapatra from Odisha and Suresh Chandak from Vadra. He's from far, but every time he'll message me, this is this. He's like actually he's excellent surgeon, excellent teacher, and better than me, I think. But wholehearted, such a affectionately, he is telling that your book is good and he's promoting and encouraging. That's the encouragement words. I'm really grateful to all these faculties, my college, different college across the country. Many times those who don't know me properly, but they promoted my book. They encourage rather promotion, rather encouraging my book wholeheartedly, appreciated my book. I'm very, very grateful to all faculties, known, unknown faculties of this country in the surgical field. They have appreciated my work wholeheartedly and accepted me as an author, which is very book is nice. So very special thanks to them. Of course, my special thanks to Dr. Bhargav, who is the backbone of my all this work in the surgical this YouTube channels. It's his idea, his backup. Dr. Rajat, Divya, Akshay, all these people were there, of course. Then so many people, my students, current PGs, everybody helps indirectly or indirectly. And of course, my special thanks to my wife, Dr. Meera. She's there always like a backbone. Next to Shreya. So Vij is the photo. He has come to my home on the other day and took photo from him. He's the chairman of JP Publishers. They publish around more than 2,000 books with the Diginor and other things. And so he is the person who supported me last 20 years for my writing books. Of course, the difficult writing books is very, very difficult, but he supported, encouraged me. And this is how I am become, because of his support, I am today like this. Next slide, Shreya. So this website, SRB Surgical Insights, dedicated to my nephew. He's no more. He met an accident. I lost him. So very, very affectionate nephew for my nephew. So Supreet Shankar. So I dedicated this insight to my nephew and my family, Dr. Meera and my daughter. Dr. Meera, my wife, is supporting me so much. So my surgical website, www.srbsurgeryinsight.com. So we'll start today. Only started putting these clip videos. Today also we'll put after the session, and every day we'll put the timing when we'll put. Always please go through this book, share, join, share, and click the bell button, and always go through this. Request everyone, mainly UGs, PG, to also join and subscribe and watch daily, briefly, brief 3 to 5 small video clips I'll put lectures, so that will be interesting for you. You can always go through the book and then widen your knowledge through the book. Regular 1 hour live sessions later, of course, once in a week or fortnight, definitely 4 days per year. I will inform what lecture we are going to do, who are the faculties. So my books, my beginner through JP, all lectures are available. You can always go through these books and beginner as for your requirement. So next slide. So subscribe our channel and press bell icon for the regular update on lectures, live chat. It's daily actually. Videos will come daily, I will assure you. And weekly, mostly weekly or at least once in fortnight, we'll have live sessions continuously. And thank you all for support for everybody, faculties all over the country and elsewhere. My students who have joined to this session and told good words about me, Tala, Rajat, Divya, Dr. Bhargav, my wife, of course, we have planned this, organized this one, backup teams. I don't mention the name, but they are behind me, and everyone who has helped me, and of course, this and again upcoming new things. I need a good support. Definitely, I will not disappoint. It will be a very good academic session to all students who are learning surgery, so that will have knowledge will increase and they will appreciate the surgical things very clearly and perfectly. So thank you very much. Bhargav?
Thank you, sir. Thank you. Dear students, we'll be posting on a regular basis some amount of practical lectures, which will be mostly of surgical principle. Okay, and you will be getting live sessions very often. And if you want any particular topic, we'll be arranging a poll every week on Telegram and YouTube. Okay, on which topic you want, whatever the poll, based on the poll percentage, we'll be doing the topic in the next week. Okay, and from the audience, we have some questions, sir.
Just tell me the question, Bhargav.
Yes, sir. Yes, sir. Yes, sir. This is from Harshita. Should we start to read surgery from third year itself for next pattern of exam?
Yes, so they have to start reading surgery, especially clinical books, clinical scenarios, third year itself, because the last minute reading is very difficult, because it's understanding surgery needs to keep on reading. So let them start as and when required third year itself, because many times they feel that only last minute you will read, that is sufficient. It is not so. To learn surgery third year itself, they got plenty of time. They see a case, come and see, then accordingly they can read whatever case seen. Then suppose there is small video lecture is put, they can today, then that day only they can go and read that about that topic and widen their knowledge, so that will become really printed in their brain, so that always when question asked, they can reproduce it very easily. Finally, it is the reproduce answers whenever asked is important. Overall, you should have bird's eye view of the surgery subject. Then each one you have to dissect as and when required, so that you have to eventually have to go into the depth of the subject in later final year. So first you should have bird's eye view, so start reading, so that fit and read, so that eventually will come to know entire subject of exactly it's, and you will start enjoying it. That is the thing. So you start reading, definitely. Don't keep it in the last minute.
Yes, sir. Yes, sir. Thank you, sir. And then we have a few more questions. Besides SRB manual, which other book would you recommend for clinical application of surgical concepts?
Surgery, Bailey and Love book is there. Hamilton Bailey, Clinical Methods in Surgery is there. A few other clinical methods book is there. All other books are also good. Any other books, but when you see a patient, read the clinical book, compare it, so that you will have the understanding about the book very clearly. So Hamilton Bailey Clinical Methods is very good book. Always we can go through that book and understand the subject in a clinical correlation. My book also very good. We can always go through that. Other books, Bailey and Law book also there. If you are able to understand the language, that's also a good book. So we all learned Bailey and Law. Very, very appreciable book. Definitely you can read that. Other books you can read, other available books. Definitely it widens your knowledge rather than reduces your knowledge. So read more books. Definitely it is useful, but you need to get the time for that. So how to get the time? It is depending on your reading habit and managing time as such.
Yes, sir. Being your students, we all read your books, sir. Clinical methods in surgery is very good. And one more suggestion is that the students, they should not take the books stand in front of the patient, start reading and examining for the clinical practice. Okay, that will look very bad. The better thing to do is you people have to go through the entire chapter, read it, then go to the patient, do all the examination, whatever is necessary for that particular patient, come back and read what you have missed on. So in this way, you can practice better and do good. So we have one more question.
Okay.
So how to start and get our foot into the world of surgical research? Any tips on how to get into, learn, collaborate, and how to approach surgical faculty for research projects?
Surgical in your college, of course, getting it foot into the surgery is by learning. That is a not easy task. It takes time to this one. It is a flow by daily learning. Surgery is the only way to get into this one. It is a surgery you won't learn by one day. It's a repeated. Repetition is the very essential in surgical field. It is not I will examine one thyroid or one hernia, then I will master it. You repeatedly examine the patient. Even doing surgery, you do surgery repeatedly and daily basis. The moment you don't do surgery for a month or two, then slowly next day when you go for surgery, to get accustomed to the surgical skill, it takes some at least few days. So it is a repetition is the most important thing. So get so wider way, everything you have to learn. There's no half learning in surgery. You can't be Abhimanyu. So that's what I used to tell to my students. Surgery should be learned to full. You can't say I know how to remove appendix, I don't know how to close it. So you need to know everything, all steps, A to Z, one to last. So it's a daily learning. It's a daily learning. Learning won't finish by MS or MCH. After that also you keep on. I am learning. For me also it is learning. It's a faculty. Everybody has to learn surgery daily, ongoing phenomena until you practice, until there's no end to learn in surgical field. You can learn, I already told. You can learn from seniors, juniors, colleagues, sometimes scrub nurse, OT people, everything. Because so vast subject is, you observe whatever, the observation, seeing. Intuition to the surgery is important. You should have intuition to learn. So wherever you have to observe, everywhere it's observation, it's analysis. So there's the end to learn. So you keep on doing it. So get a platform, good platform, so that you develop confidence. Very, very important. Good confidence is very essential for surgery, but not ego. Remember, ego is very dangerous in surgery. Confidence is very essential. I will do that. I can do that. It's very, very important. But I only doing, nobody else is doing. That is the most dangerous thing. So always leave that habit of that. I only will do that. Others doing is wrong. Others will not do it. Everybody will do that, but you also do that. I will do this surgery very well. I will do hernia very well. I will do this thing. But I only doing, others doing is wrong. That attribute is called ego. That definitely will not help in surgical field. But confidence is very, very essential in surgical field, whether it's learning, academic, or doing surgery. If you are not having confidence, major surgery you won't be able to do. In a small surgery, you will struggle. So that confidence is important. That requires a knowledge, that requires a skill, that requires a commitment to treat a patient. Dedication. I can't say I'll see patient tomorrow or day after tomorrow. Not that. I keep on thinking about the patient morning to evening, and that is the only way to have a good become a good surgeon. It's an ongoing phenomenon. Once you become a good surgeon, to maintain that quality requires a sustenance. So it's an ongoing phenomenon. So you need to be always, at least in a reasonable good way, to manage these patients and do a teaching also. You keep on update. You have to update your knowledge also. Keep on new things you have to learn. New things will come. Now, of course, I learned initially laparoscopy was not there when I become surgeon. I learned laparoscopy, at least basic lap hernia, chole, that is everything I can do. And of course, now robotic is come. I'm rapidly going for robotic training. So you keep on learning. New thing you have to learn. You can't say that is not for us. That means you'll become a back. You won't be forefront. You'll be back front. You need to become forefront in the surgical field. Otherwise, because new things will come, you need to learn at least basics of newer things. So learning is the only way to become come forward. Like you can learn everybody. Don't keep any ego in that.
Sir, Rajat, I wanted to add a point.
Rajat, tell me, Rajat, please.
Yes, sir. So the students were asking about surgical research, sir. So just having published a few papers under your guidance during my residency, sir, just wanted to tell them about research. So surgical research for students, it's basically don't have to go looking for topics. The topics will come to you as and when you're practicing the surgery itself. Like when you're seeing new cases, some rare cases, you can publish those as case reports. Or when you're seeing different surgeries, you will only come. Like one topic that sir had published, we had published with sir, was about sentinel node evaluation for carcinoma stomach. So that is when we were operating cases of carcinoma stomach. We were initially wondering what node should be removed and what nodes are involved. So we came up with the topic of doing sentinel node biopsy for stomach, which has not been done or evaluated extensively previously. So such kind of topics which will automatically come to you, and then you can think about them, work on them, and take them to your seniors, to your professors, who will help you fine tuning it, and you can conduct those studies and publish them as papers. So students, practicing surgery and looking at more and more cases and patients is the only way you will find surgical topics for research.
That's absolutely right, Rajat, because every day we get, because almost regularly in our unit, uncommon cases are, we get very commonly, of course, interested cases. So somebody has to go through and start publishing it. Detail you have to learn, you have to refer books, then make a note of it and do that. Enough material, at least in our college, it is there to publish. And same thing holds good to many other colleges across the country. Definitely students should have a learning intuition for that. Of course, if students come forward, then of course faculty will never say no. Then they will guide you. You go through the reference, start learning how to publish. Initially, it becomes very difficult how to write, how to write abstract. That methodology to go through that, all those font, this one references, who is the author, referent authors. So keep on doing 2, 3, 4 publications method. You got enough material. That's what in this country at least you got enough material in most of the colleges, especially in government setup or established colleges. So you can always, you got enough material, you have intuition, develop intuition to do that. Definitely your teachers will guide you. You do that 2, 3, 4, then you know how to publish, then it will become a momentum and become a regular phenomena. So that's it. That's what Rajat rightly told. You got enough material, only thing is you foresee and start doing that. There is a research, is intuition. You should have a intuition for that. You should, otherwise you find difficult, then you will draw yourself. It is difficult, I can't do that, because it takes time. But you need to do that. That's important. Currently, of course, research is very, very important for promotion, other things, especially when you go to international platform. If you join to UK, all the things, your research resource is very important to get selected. So selection also it's important. Of course, learning newer thing, how to do this one. You learn a lot when you do a research about certain topics. Definitely accepted. A good point, actually, Rajat. Vargo, any other?
Yes, sir. Thank you, sir. We have one more question, sir. Any video courses or book to get insight into the practical skills required as a beginner in surgery operating room?
What? No, I can you repeat the question?
Yes, sir. Like he's basically asking, are there any video courses or book to gain knowledge about the practical skills that are required in the operating room while operating, basically?
Yeah, my operator surgery book gives every detail of each surgical steps, so surgical operations and surgical steps. Of course, DigiNow also has got a operative skill. Live videos are there in my DigiNow. All operative positions given, and suture process shows the skill actually. Video skills are there. How to do suturing, everything is there. Of course, eventually skill you have to learn with the patient, with the guidance of the faculty and seniors. So under guidance, initially you know that current pyramid, you know that how to know, do and show, then show, like that pyramid is there, no, same thing. But you have to finally, you whatever you go through these different platforms, finally you have to start doing it under guidance. Eventually you do it, then get the pinch of that. Unless you feel the tissue, live tissue, with the feel and doing, it has to come once you do that only. So you need to be there in the OT. Initially you should be guided, eventually start doing it, then you develop a confident. So that is the way only you can learn that. Finally, you have to be in the hospital to learn surgery. You cannot be outside the hospital and you think that you will learn surgery is impossible. Surgery should be learned in the bedside, OT, OP, and in the hospital. Emergency is there, post-operative is there. If you are around the hospital, immediately some call comes, see the patient, then think of whatever you're doing, then you can communicate faculty, then you know, or observe what is the problem, then immediately we learn. Because of course, our PG postgraduates here, they are good, they manage well. Even interns, good interns are sometimes, they do very well. They work 24 hours in the unit. Sometimes I feel bad, but still they are good. They work, that's how we'll be there in the hospital. Then you will learn everything. You observe, see what is happening. That's the only way to learn. Unless you are in the hospital, you won't learn. That's a basic requirement, especially in the surgical field. Because here you have to be there with the patient. What is happening to the patient? Everything should be seen. Everything should be learned bedside in the hospital. And of course, eventually you need a support to this one as a platform or YouTube channel that is everything to correspond and learn what to do like this. Everything can use that textbook and everything. But to learn final skill, you have to be in the hospital. You have to be in the OT. You have to be with the seniors, faculty, teaching faculties. So, Bhargav, that may be the answer.
Yes, sir. Yes, sir. Thank you, sir. We have one more question from Bhageshri. In Ayurvedic department of Prasuti, Stri Roga, that is Obs Gynae, we cannot do major surgeries. So what are the minor surgeries which are more nowadays?
In gynecology he is asking.
Yes, sir. Yes, sir. In respect to gynecology, what minor procedures are possible for them to do?
For them to do, I don't know legally what them to do. They have to be with the gynecologist. Maybe small D&Cs and those things only they will be allowed, because they should look into their prasuti.
They have their legal obligations for that.
Legal obligation. Their prasuti part is there. So that is the platform.
What is permitted under them?
Under them, they are skilled. They can do that. What is permitted as far as their counsel is considered, what they have taught, that may be legally permitted to do. So I won't be able to tell what they do unless if they are trained well with the under gynecologist for a few years. Definitely they can. So like Divya trained with me for 6 years, because he has learned most of the surgeries. At least he has seen, assisted. He has got fair idea about surgical field. So like that it happens. Of course, still they have got a legal binding to this. So they always look at the legal binding to do these things. That's important.
Yes, sir. Yes, sir. Totally agree with you.
Yeah. So any other question?
We have one more question, sir. This is regarding book publishing.
Okay.
How to go for book publishing? How reliable are publishing houses?
Yeah, book publishing is need a good publisher, one. And second thing, our manuscript should be good and should be own. I can't take photos from online. I can't take any illustrations from the online and clip and put into that. I should draw illustration on my own. I should have our own photos, not copy a photo from the online and put it into the book. Everything should be own, and you can't copy anything. The copyright will come into the picture. And that's also important for publishers. Your manuscript initially they will take it out. Usually, first when you book, you will give the manuscript with diagrams, everything. They will edit. Then they will send the first proof. Again, will correct and send. They'll send second proof, third proof. Until second proof, we can add, deduct everything. Third proof is the final one. Everything is finalized. You go through that spelling mistakes or change of the photos. Sometimes photos will be, you thought this year, you may have to change it. So all those things you can do. Sometimes we can go to the publisher's place like Delhi, stay there for a week or so. I've been staying there for a week or so in my manual editions earlier for a week. Day and night I used to do that. Morning 8, 9 o'clock, if I go there till late, 1 to 2 o'clock, we used to do the continuous edition, of course. Or publishers, AP publishers used to give enough man support for that without any problem. Of course, we used to have food, everything there only, and used to edit continuously for 7 days, so that in spite of their mistakes will happen, spelling mistakes will happen, because the voluminous book, we overlook many things. Because that's why keep on asking students, many mistakes, please inform me. It will be good for me, because somebody else has to show your mistake, not ourselves. So that will be good for us to go for the next edition. I can correct it. So I get many times feedback, this is the mistake. Definitely I appreciate them, because it takes a lot of energy, lot of intuition and dedication. Many times we get exhausted by doing edition. It comes at a final, because index also we have to do. Index doing is a real laborious work. So it takes time, but once you get a good support from the publishers, things will happen. But you need to keep on doing it. You need to work hard to get a book. It's not an easy job. But I have done it. So people better than me, they can do better book. Definitely, there are enough people around who are interested. Definitely, they can do that.
Yes, sir. Yes, sir. And there is one more question, sir. Is the approach for surgery for a specific disease same in all patients, or is it dependent on the patient?
No, this approach for specific disease is not same. It is maybe similar because it is the individualizer. That's why all these books are given this exactly. So every patient is different. Your approach is different. Today I get one patient with malignancy. My approach depending on the situation, staging, grading, location of the disease, everything. So guidelines will be there in the books. Standard methods will be there. But even cellulitis, our approach for each patient differs because that day patient situation, patient backup, everything will look into that. What probably antibiotics required, how severe is the sepsis, how toxic patient is there. So it is individualized even though similar guidelines. It is not same antibiotic what other professor has put, other surgeon has put, I have to put. My intuition, my thinking, mine is different. I may think that this patient is going for a toxic, he may go for a septicemia, he may go for a multi-organ failure. So I don't want that to happen. So before that only I'll start putting higher antibiotic. So depending on the situation, look at the criticality of the nature, look at the requirement of that particular patient, even though you got a backup guidelines and book support and knowledge support, everything. So your application of knowledge which you are having as a backup, that's very, very essential. In an individual patient, by analysis, you decide how to approach. This is basically the surgery is the analysis. It is the decision making. Surgery is decision making. Bhargav, you know now, you are experienced surgeon now. You are
Yes, sir.
now. Every patient differs. It's a decision making and thinking until the patient, you send the patient back home after major surgery. You're always worried. You are always stressed. But even though we practice that, we don't express it outside. It always inside will stress it, but never expressed outside because by practice it comes to us like that. But in every patient is different. Every patient requires a specific monitoring during surgery, after surgery also, until they go home safely. So that is the thing. So even though you got a backup support, that is there, guideline is there. So it is individualized. So it is not the scanning or CT decides what to do. Imaging is important, but finally it is a combination of imaging plus your imagination. It's a clinical thinking. Everything is clinical thinking. Everything is a decision making. Of course, in Western countries, everything is guideline, but it's not suitable in our setup. I still feel that decision making is very, very important. Every patient is individualized. That is how exactly you should go about and treating the patient. I think most of the senior consultant faculties in this country definitely will agree with me. There are better surgeons in this country who are working every day, wholeheartedly, honestly, with a lot of clinical acumen. Of course, definitely they agree with that because the clinical acumen is very, very, very crucial in making the patient sail through with their problems as such.
Yes, sir. Truly said, sir.
Right. Then any other question?
We are done with questions, sir. So, like, it's almost 1 hour, so
Okay.
we'll conclude.
What is again? I think I'll request all students to join this, join and subscribe my channel. Of course, they have to press the bell button also because daily basis, it is a daily phenomena. Daily, I request everybody to daily watch the video lectures which come daily. Of course, we'll put forward for the regular lecture like you said. That will come 4 days per year. We'll organize with the organizing team I got. So hope things will be very useful to everybody because that will definitely upgrade their surgical knowledge for exam as such and their surgical knowledge widen to eventually to select surgery as a post graduation or after that to do surgery also. Definitely it will be helpful because it's not one day match. It's a daily we'll do that. That's a point we should be assured that. Thank you, Varka.
Thank you. Dear students, Surgery Insights is live on all the platforms like Instagram, Facebook, Twitter, and LinkedIn. Kindly follow, subscribe, and like, hit the bell icon so that you'll get the notification whenever we upload a new video or new lecture. There will be ample amount of lectures from which you will not get bored for sure. Okay, they will be of shorter duration and will be precise to that particular content, and we'll have live question and answer sessions very often, and you'll be having live lectures. Then the lectures will be based on the poll from which the topics will be selected. And on concluding, on behalf of Surgical Insights by Dr. SRB, I would like to extend my heartfelt gratitude to each and every one of you for your active participation and valuable contributions to today's event. I especially thank Dr. Mira ma'am, Dr. Rajat, Dr. Tala, Dr. Divya for their contribution. I especially thank to Whitelift organization for their exceptional work in organizing and facilitating the meeting, ensuring its smooth conduct and meaningful outcomes. Let's carry forward the momentum generated today as we continue our journey. Thank you once again, and we look forward to our continued collaboration in the future. Good night.
Thank you, Bhargav. Thank you everyone, Rajat, Tala, Divya, everybody who have joined, all students, faculties who have joined. I thank you very much wholeheartedly for watching this session very well. Thank you very much.
Thank you, sir.
Thank you.
Thank you very much, sir. It was a great
Thank you, sir.
meeting.